There is anxiety and panic since news of COVID-19 cases from China has flooded in. We are here on Chai Tea with Dr.D to discuss what this means to us and what do we need to do. What we need to do are the 3P's. Don't panic. Take precaution and focus on the parasympathetic nervous system. What does this mean? Don't panic because let's look at the data of COVID-19 in India over the last year. This data is from the patient group in my clinic as well as their friends and family. This data has very closely mirrored the data from other medical groups right from the time COVID-19 started. December 21 and January 22, we saw a wave of the epidemic again. This had Delta and Omicron. By January of 22, it was the Omicron virus that was predominating. Now this was good because the Omicron virus now affected more the nose, throat and sinuses, unlike the other COVID-19 variants which were strongly affecting the lungs. This is not to say that the Omicron doesn't affect the lungs at all. However, the numbers of those cases are much less severe and more often seen in the senior citizens or very immunocompromised people. As we went ahead from January to May, gradually there was a decline in cases. And then COVID-19 in India became more endemic than epidemic. What is the difference in this? An epidemic case or an epidemic group of infections is where if one person has it, it's very likely that at least 80 to 90% of people around him will have it. So your schoolmates, your people at home, people at work, if you were infected or somebody from your group, everybody would get it. But in an endemic, the virus is all around us. But we only catch it if we are susceptible to it. It's like other virals like flu. They happen every year. There is a time zone when it peaks. But everybody doesn't catch it. Those who are more susceptible to it catch it. Then from May onwards, with this endemic happening, we still saw cases on a decline. The good thing is, even though we are hearing of a higher number of cases in China through the month of end November, December, right up to the time I'm talking to you today, the cases in India have not gone up. That decline has continued so far. Hence, it seems like we have built an immunity, an immune response, as well as the variants have got milder, that allows us to fight this infection and in many of our cases prevent it getting to us in the first place. And therefore, there is no need to panic for it. However, we must take precautions. Why do we need to take precautions? Month of December is a travel time where people from all over the world, especially students from universities, have come home. So you have people from Singapore, UK, Europe, US, all of them coming in at this particular time in a large number. It's the time of party. It is the time of holiday season. It's the time where in the last 2 months, the masking has dropped. And therefore, if they are carrying the infections in at this moment, we will only know by next month. The cases will begin to go up only by next month. Hence, it is important to take the precautions right now. What precautions would we take? Mask up. in groups, in parties which should be in smaller numbers, when you go to restaurants, when you're in elevators, when you're in closed spaces, shops, vegetable vendors, wear the mask. Even if people around you are insisting not to wear it, don't be embarrassed. Wear it, explain to them why it's important right now to wear the mask as a preventive. The symptoms of this Omicron variant, despite the changes of the variant, have been more or less similar, which is that there have been mild cases where there have just been cold, cough, and sinus congestion. 2 cases with 102, 103 fever that lasts for about 3 to 4 days with very severe throatache and headache. In most of these, they test negative between day 8 and day 10 for sure. However, as this turns endemic, it also means that a large number of cases around us are asymptomatic. And therefore, you could go out into a group with people having no symptoms and you could end up catching it. Hence, prevention being much better, it is better to mask up. It's very important to protect our senior citizens as well. So this is why do not panic. This is why at the same time take precautions. Please note that at this moment the cases in November and December in the US have definitely shown a slight increase, and a lot of our students have come in from the US. However, the cases and the symptoms have been milder, as I explained to you, and many asymptomatic. Therefore, there is no cause to panic. Now we come to the third point. Focus on the parasympathetic nervous system. What does this mean? As I said to you, the situation in India is now that COVID-19 is more endemic, which means the virus is around us, people are having asymptomatic infections, and you are meeting and you are getting exposed to that virus without knowing it. However, if your immune system is good, you're having a good immunity, it is not likely to affect you. But if your immunity on that day is low, then you could become susceptible to that COVID-19 infection. And therefore, it is important to bring up that immunity. I'm going to remind you of that one more talk we had on Instagram, which is on the connection of stress and immunity. I'd recommend you go back and just listen to that again. It has the picture of me sitting and a tiger attacking. Because one of the biggest causes of lowered immunity, other than of course you having already had some infection, you suffering from other chronic illness, you being on immunosuppressant, is stress. Because stress stimulates the sympathetic nervous system, causes a rise in adrenaline and cortisol, and causes a drop in the immune system. And that's the point you become extremely sensitive and susceptible to it. How do you recognize it? If for a few days your mind has been working at a roll, and at the same time it's not a happy roll, you're feeling uneasy, you're feeling agitated, things have been happening around that are upsetting you, your sleep is not good, you're waking up thinking many things, waking up with a little palpitation, being upset with the people and the world around you, this is the time your immune system is definitely low. If at this time you are going out to a group or a party, please be sure to mask up. If you are on homeopathic treatment, take your constitutional remedy. If you are not, please take Cymex, and even if you are on constitutional remedy, please take Cymex 1 ml twice a day for 2 days at this time. What to do to build your immunity other than your homeopathic remedy is to focus on the counter of the sympathetic nervous system, and that is the third P, the parasympathetic nervous system. Again, I'd refer you to our Instagram talk on breath and the importance of breathing, because breathing is the only control that we have on this otherwise automatic nervous system. When we take deep, slow, calm breaths, we are stimulating the parasympathetic nervous system, which will bring down the activity of the sympathetic nervous system and bring up your immunity. So recognizing that I am in this moment where my immune system is low, and therefore I should either avoid going to such gatherings, do the breathing, bring back my system to normal, take the preventive homeopathy if required, would go a long way to prevent this infection from getting to you. On the other hand, as I said, January is going to really tell us where we are. As far as things stand today, it definitely looks like we have in our country a overall immunity that is keeping this virus away from us. Also, while there have been different variants of the Omicron that have happened through the year, more or less the symptom group has been similar and it has been milder in that way. However, as I said, we still have to look at what this new variant could bring, and yet I would say there is really no need for panic. So take care, take precautions, and let's bring in the new year, keeping COVID-19 as an endemic and not allowing it to get to the epidemic proportions. Take care, build your immunity, enjoy as we enter the new year.